I really believe that, since we are making a very focused effort at influencing our employees to do healthier behaviors and live healthier, we need to provide the resources and the tools for them to use in order to be successful with the goals that they've set for themselves. I meet with pretty much, I'd say 3/4 of the employees here. We have about 800 people that are in the employee wellness program. So, we ask them to set whatever their realistic goals are, but I feel like it's then our responsibility to support that. So it can be the deciding factor in whether or not they actually follow through with their commitment. We give now, you have the choice. You can choose the healthy stuff or you can choose the unhealthy stuff. And it's not like it's in your face or anything like that. But they're appreciative that there are choices, I think. I mean, many of them, when they come to their one-on-one meetings with me, of course they're saying, well, I'm choosing the healthier items now because they're available. Not that they weren't available before, but they're now in the forefront. It's something that they see. The first thing they see on the line when they come through is that healthy meal. They have the sign in front of them that tells them what's in it, with the calories, and it makes them more aware of what they're choosing. That they have now a visual reminder when they go to the cafes that will keep those wellness messages kind of in the forefront of their mind throughout the rest of their day, which I think is something that they didn't necessarily have before. It would be maybe an option for them to go to some of those educational things, but now they have those resources in front of them in the cafe, which a lot of them go to every day. But we do have the tool on the internet where they can actually look up the nutritional information before they go to the cafe. I think that's been a great resource. People actually can plan out what they're eating a little bit more, which has, I think, helped people to do that in other parts of their life too, and become more aware of their labels and things like that. So you can see it in little pieces and parts. And people were pretty much open to it already, and it's almost like it was time for it. You know what I'm saying? Like it was something that people would have expected to come, because we have already done so much to set up the expectation that people live healthily and that we want to support them. So any amount of support that you can give to making your employees healthy is and the community healthy, especially since we're in the hospital setting. We reach so many more than just our employees. So any efforts that we can make, it's going to shift our healthcare model to a well care versus a sick care model. So I think that's a big part of it. The food we provide, I personally think of food as medicine. So we should be providing just as good food as we would provide pharmaceuticals. The standard should be greater for the food we provide.